Vic often stated that he thought God was more interested in healing our hearts and our souls than healing our bodies. But yet, God was a great physician, and Vic was a great physician too, I guess, huh? Wow.
40 years ago, just about this time of year, received a call from Rose Lampton. Her and Joe had settled in Zanesville, and they were patients at Marco Medical Center. And she said, my brother Vic is finishing a surgical residency in Hawaii, and he's coming out to look at some practice opportunities in Ohio, Virginia, and North Carolina. And she said, my husband and I think that he would fit in well with Marco Medical Center. And we weren't looking for a doctor at that time. She said, I think if he could come down maybe and talk to you the evening he's going to stay at our house when he goes out east, we'd appreciate it. But we were looking forward to it. And he came and spent the evening, and we showed him Marco Medical Center in the office and told him about the community. And then he went back to Zanesville and on out east. He called us a couple days later from Virginia and said, you know, he said, I've been looking at medical practices, looking at opportunities, but all I can think about is Marco Medical Center. I think about the opportunities back there. I think the Lord is leading me to Marco. Would you mind if I just cut the rest of my trip short, come back and spend a day with you at Marco and see what the practice is more like? Well, now we're excited. This is great. We hadn't been looking. We could use a doctor, and we certainly needed a surgeon. Wells Community Hospital had to always send their patient to Fort Wayne or get a surgeon down from Fort Wayne. We needed a surgeon. And he came and spent the day and left us with the thought he was going to talk to his family back in Hawaii, and he'd let us know. Well, of course, that summer, he came in and joined our practice. But we didn't know much about Vic before, except that he graduated from Ohio State, and he did complete a surgical residency, and he was head chief resident during his final year. So, but the first couple weeks he was here, we had some horrendous surgeries, some emergencies that came up that just needed care and needed expertise right away. But we had a good look at him immediately. And we found out right away he had the hands of a surgeon. He could do things with his hands. He was very gentle with tissue, and yet every movement he made just seemed to flow. He did things very well. He had the hands of a surgeon. And he had good judgment, based on sound medical practice, and medical knowledge. He had the knowledge, and he could make up his mind very quickly what needed to be done for the patient's best benefits. But we found very early that we had a great surgeon with us. We also learned that he could think outside the box. He could, when he was one of the first ones in the whole area to start saying, you know, we can do same-day hernias. I can do the hernias and they can go home the same day. And they did. He was one of the first ones to do that. He soon said, you know, we don't need to put tubes down in the stomach for a gallbladder surgery. Let's get them up and let's feed them and they go home. And he was one of the first to do this change. And I was talking to one of the nurses here before, and we talked about the fact that we just didn't have complications. We didn't need near as much blood. We just did things so well. Well trained, they had the hands of a surgeon. And we were very fortunate in practice that he also had good knowledge and was willing to do family practice. Because when he came, we didn't have surgery all the time. It wasn't enough surgery just to keep him busy. But he was willing to take calls. He was willing to deliver babies. He was willing to look at ear infections and to treat diabetes and depression and hypertension and heart disease. And he was good at those. He had a good knowledge, good basic knowledge, which I think, even as the years went on, helped make his surgical practice even better with such a basic knowledge of the human body. He was also good at picking up new things. He could, he was always reading and studying and come back with new ideas, even some of them that he wanted us to follow up on. But he would learn laparoscopy when it came out, and endoscopies, and biopsies of different organs of the body. He was very good at each one of these things, and he knew well what he could do and what he couldn't do. He was very good. And then when we talked about him, he knew about horticulture and the things. He knew about construction. He knew about geography and world history and literature. We sort of thought maybe he knew everything. And then there was one Saturday. One Saturday he was mowing yard. I think Laurel and Jeff are probably old enough to remember this, that he mowed into the cat, a family pet. Yeah, he hit the cat and cut the cat on the side of the body. And he had compassion for that cat. You know, he needed to do something with the cat. So he went to put it out of the pain and helped him sew it up. And he went and gave the cat a shot of Demerol. Well, that cat went wild. He started flying around, the fur was flying. This thing was spinning. It took him a long time for them to get that cat under control. They took the cat in a box down to Dr. Reed, the veterinarian, in Markle, and Dr. Reed just laughed at her and said, "Oh, you're a good surgeon for humans. I think you need to stay away from animals. You just never give a cat a shot at animals. Because that's the opposite that it does for humans." So, we know he didn't know everything. He didn't know a lot. Now, when we came to Markle, Dr. Kinzer and I, we were very interested in missions, foreign missions, medical missions. And we thought we could maybe get away for a week, 2 or 3 at a time to do some short-term mission work. When Vic came in with our group, and the 3 of us, and we talked about it, and he said, you know, if one of us gets a call to mission field, we need to go, I think one of us could go for up to a year. And the other 2 can work hard here and support that doctor that's gone and keep the practice at Markle going. And we all agreed with that. Within a year, my wife and I and our family, we went to Somalia, East Africa, for a year of mission work in an emergency situation. When we came back, Dr. Binkley and his family went to Bangladesh for a year. And when he came back, Dr. Kinzer went to Zaire with the Methodists. And by that time, our practice was growing. We had more Christian physicians in our group. They all had interest in missions. And we're fortunate that with that time, in 1976, Dr. Binkley arranged with working with the Church of God and Project Help in Haiti, that we could have all a common focus on a mission. And one within the Western Hemisphere, one that's the poorest country in the Western Hemisphere. And drawing up the plans for the clinic, we're praying about it, we all had interest in the same thing. And we got the clinic going, and the doctors in our group would spend 4 to 6 weeks or 8 weeks there at a time. I heard Dr. Kinzer say today he was there 26 times. And over the years, we could see the growth. After several years, we saw the people in the village and around there were healthier. They were doing well, but the clinic could do more. And the Binkley, Donna, and Vic then agreed to go full-time to Haiti. And I know that Vic worked so well with people in our office, in the hospital. He could get along with nurses. It was always smooth. We often say he came up with the ideas, but he expected us to do the work. Functioning and organized. Well, in Haiti, he worked very well with the Haitians. Understood, willing to listen. He could pick out people that could be leaders, people that do the different tasks. And he turned it over to making the clinic more with Christian Haitian doctors working there. And then building a maternity ward. And then building a hospital and building a surgery unit. He added so that this became a very bright place in Haiti. And he had good ideas for church growth. And working along with the Church of God and Markle Medical Center, this has been a blessing over the years. And certainly Vic was the instigator, and we just admired him. I refer to think back of Matthew 22nd chapter, where Jesus was asked, what's the greatest commandment? And he said, to love the Lord your God with all your heart, with all your soul, with all your mind. That's the first and greatest commandment. And the second is like unto it, thou shalt love thy neighbor as thyself. Vic loved his Lord, and you heard this here. He loved the Lord, and he also loved his neighbor. He was willing, whether it was here in northern Indiana, or whether it was in Bangladesh or Haiti, around the world, he loved his neighbor and he treated him well.